And thank you for joining us for this special presentation, Monitoring the Coronavirus, Asking the Experts. I'm Sarah Diamond.
And I'm Jack Smith, and these are the experts. We are joined in the studio today by some really great local health leaders who are tonight joining with us and wanted to get you the information as much as possible about the coronavirus, COVID-19. Here with us now, Jessica McKee. She is an infection prevention specialist with Ballad Health. Also here, Heather Mullins, an epidemiologist from the Sullivan County Regional Health Department. Welcome to both of you.
We also have Dr. David Kiersche from the Northeast Tennessee Regional Health Department and Dr. Blair Reese from the Quillen College of Medicine. Thank you all for joining us tonight.
Sure.
We're going to try to get as much information out to our viewers as we can in this half hour. So, Dr. Kiersche, let's start with you. The state of Tennessee, as of right now, has only tested 88 people for COVID-19. It seems kind of like a small number. Can you tell us a little bit why more people have not been tested?
Yeah, so really our testing capability has been limited by the number of tests we actually have. So we've been trying to target it at the most high-risk people, including in our area of Tennessee. So really just we're having to prioritize.
Okay, like people who have traveled internationally,
exactly.
Things like
have
that.
Close contact with someone or been to any communities where there's community transmission.
Okay.
We're looking now on the screen, Dr. Kiersche, that number jumped from 9 to 18 this
Overnight,
afternoon.
yeah.
What do you attribute that jump to?
Yeah, just really more testing. So in the beginning we had very limited testing. It's expanding, but we're not able to test everyone we really like to test at this point because it's all having to go through the state lab. But now the commercial labs are on board, so clinicians and hospitals do have the ability to also send it to a commercial lab and not just have to go through the state lab.
And should that number, should you expect it to increase?
It'll keep increasing every day, yeah.
You think so? People
Yeah.
should prepare for that.
Exactly.
Dr. Reese, thank you for joining us, but we want to go to you, Dr. Mullins. Sullivan County had that first case. Heather Mullins, I just made you a doctor.
That's okay, I'll take it.
That was jarring for a lot of people.
Sure.
And in that announcement from Dr. May, the news was that there was not community spread,
Correct.
that there's any proof of that. But there's a lot of concern that it is spreading in the community. We just haven't done the test to prove it. What proof do you have that there is no community spread? Or are you concerned that there could be?
Well, at this point in time, we know that there's no community spread connected to our current case in Sullivan County. We do really strict contact tracing on this individual from the time this individual returned back into the United States, reported to the health department with their symptoms. So at that point in time, that individual pretty much isolated themselves at home until we were able to get that person tested. So we know that that person was not out in the community once they arrived back into the United States.
All right, Jessica, we've been seeing so many events canceled or suspended, especially today from the national level. We're talking about NBA, NHL, to the White House suspending visitors there. But on a local level, do you feel that we are being aggressive enough when trying to slow the spread of this virus here in our area?
I do feel like we are being aggressive enough. We are monitoring the situation very closely at Ballad Health and working with the health department to ensure that we're keeping our community safe and following the CDC guidelines of spatial distancing and keeping our most vulnerable patients from contracting this virus.
Yeah, I might just add that one important thing is you don't want to cancel everything too soon. For instance, you'll be talking about schools later, but if you close them too soon and there's not spread in the community yet, you have all those people using their sick leave. Right. Parents having to stay home and a lot of expense. And then you may have to keep doing it for a long time after that. So it's really a timing thing. So, we're all working together, hospitals, schools, health department, trying to figure out the right timing for canceling things. But we do ask that people that are having large gatherings consider the possibility of canceling, especially if they're in the future from now.
Yeah.
Dr. Reese, we're in flu season, and some of our viewers, we're going to answer your questions in a moment, but some of our viewers are saying, this is getting blown out of proportion. Why are you all so worried about this when flu is here? 11 pediatric flu deaths in the state right now. Help people understand why this is getting so much attention in the midst of a flu season.
And that is a great question. And right now in the state of Tennessee, we have far more flu cases and flu deaths than we have of COVID-19. But this virus is a new virus that no one in the world has ever been exposed to. No one in the world has any immunity other than people that have gotten it and recovered. And so we are all susceptible to this disease. And that's the concern, is that with flu we have vaccinations, we have treatments.
Right.
We don't with COVID-19.
That's the novel part, right?
Yes, yes.
And I think for days I heard that term and thought, oh yeah, I know what that means. That means no one has ever had this before.
Correct. This is brand new for every single person on the earth.
All right. We're going to take a break really quick. We're going to come back with our panel of experts talking about COVID-19, getting some answers for our viewers. We'll be right back.
Welcome back, everybody.
Oh, what?
Our special program, Monitoring Coronavirus. The experts are here in the studio tonight.
Yes, we're answering some viewer questions right now. Let's get into it. Let's start with Dr. Kirschke and anybody else who wants to join in. A big question on everybody's mind: how contagious is COVID-19?
Yeah, so around the world we're seeing community spread similar to what you would expect with influenza, which is obviously a concern because it's a little bit more serious than influenza. We think that every person will give it to like about 2.5 other people. So there can be a lot of spread. It's spread primarily through what we call droplets. So someone sneezes and coughs into their hand, then they shake your hand or touch a doorknob, then you touch the doorknob and touch your face, or eat without washing your hands, and that's basically how it's spread. So close proximity to a sick person within about 3 to 6 feet of someone that's sick, or touching an object they touch.
So similar to the regular flu, I guess, that we experience.
Yeah, much the same way, yeah.
Okay.
Dr. Reese, we're seeing people having their temperature taken. Are you coughing? And then there's all this information we're seeing that you may actually be incubating this for days before actually demonstrating any symptoms. What is the actual scientific knowledge at this point on that?
So, we don't have a very firm answer on that. You are most contagious when you have symptoms, but we do believe that people are contagious before they have symptoms, and that's why the work of our public health officials is so important, doing contact tracing, trying to encourage people to self-quarantine if they've been exposed to a symptomatic or an infected individual.
And I can add on that a little
Please
bit in
do.
regards to incubation period or exposure period. So that's the time frame when you're exposed to the virus, the time it takes your body to start showing signs and symptoms. So for this one, what we know right now is the average is about 5 to 6 days, and the range can be 2 to 14 days before you start showing symptoms. So 5 to 6 days from the time you're exposed to when you start showing symptoms.
Yeah, and the whole reason for quarantine is we don't want someone in public when they become infectious, because they may not have symptoms yet. So it's better if they're at home in quarantine if they've been exposed, if they do become sick, instead of being in the public.
Okay, this next question rather is for Jessica. This is a viewer question. Elijah wants to know what measures are in place for dealing with capacity problems like ICU beds under the assumption if all of these suppression activities fail. We want to know, our ER is going to be inundated. Is this going to be an issue?
Sure. So with any pandemic, we have a pandemic plan at our Ballard facilities, and we have a variety of measures that we are putting into place. We've implemented our emergency operations center, so we're ensuring that we have enough resources for our facilities across the system in both Tennessee and Virginia to make sure we're getting those resources out to the hospitals. And we're also keeping in close contact with our health department colleagues and monitoring this virus as closely as we can. As closely as
you can, for sure.
Exactly, and I was just going to add that Ballard also is saying they have a hotline that people can call.
Absolutely.
Tell people about that in case
So we
they're
want
not
to
sure.
encourage people to call the hotline. It's our nurse call hotline. If you feel like you want to be tested for COVID-19, we want you to be able to call. So you can call the nurse call. It's 833-8-BALLAD, and that will put you directly with a nurse, and you'll talk to the nurse, and if further guidance is needed, then they'll put you in contact with a physician and then give instructions on how to do that testing.
Dr. Heather Muthel in Sullivan County tonight, a lot of viewers tuning in, one of them asking this question, actually several asking the same question. If you get it, can you get it again?
Well, that's something we just don't know yet, and that's a lot that we're hearing right now, and I know that's not what a lot of people want to hear, but there's just so much we still don't know because this is still so new. And what we know is that this is the story of COVID-19, and we just don't know the story of COVID-19 because we're in it right now. So.
Thank you for the honesty, whether we wanted
it's
to
true.
hear it or not. We appreciate it.
Yeah. We're going to take a quick break. We're going to be right back with more questions from viewers as Monitoring Coronavirus, Asking the Experts continues right here on News Channel 11. Stay with us.
Welcome back to Monitoring the Coronavirus. We have experts here in the studio, and we are answering your viewer-submitted questions today. And Dr. David Kershke will let you and others who have joined us on the panel answer this first one.
Yeah, Linda wants to know, if you have symptoms, what, if any kind of medicine can you do to help you, the question says help it from getting so bad, but we can also, maybe controlling symptoms too, if there's anything.
Yeah, so there's currently not a specific treatment for coronavirus, and there's also not a vaccine. So the main thing is supportive measures, hydration, cold medicines if they make you feel better.
So treating symptoms,
Yep.
basically.
And
is-
if you get sick enough where you need to go to the hospital or see your primary care provider, call ahead and let them know you're coming so they can be ready to safely assess you.
Don't show up.
Don't
Call.
just
Right,
show
we
up.
would, that's a great point. At ETSU Health and at Ballad, we are encouraging our patients to call first. This is a special situation where a lot of us do want to give you medical advice over the phone, where normally we say we want to see you instead. This is a little bit of a different situation. So please do call us, and your physician will get back with you if you need to speak to a physician, and we'll advise you further.
Dr. Reese, Zach asks, should I change my day-to-day activities? And if so, what should I avoid?
So that's a good question, and it kind of depends, Zach, on how old you are and what medical conditions that you have. Currently, the CDC is recommending high-risk people to start doing what we call social distancing. High risk is greater than age 60 and people with chronic medical diseases, lung disease, heart disease, diabetes. If you fall into that category, then we do encourage social distancing. That means avoiding large crowds, trying to stay about 6 feet away from people in public. If you do not fall into that category, then you should continue your day-to-day life as you already are.
I just want to comment on what just came up on the screen about wash your hands frequently, stay home if you're sick. So these things are things the governor said in a press conference recently that they sound simple, but that doesn't mean they're not important. The thing is, we need to do them. Every year we say that about flu, but
Yes.
obviously people don't follow those. So we need to follow those strictly to avoid spread in the community.
Yeah, and we're really getting the message now with this with COVID-19. We have a question, I believe, from Joanna. How is the virus impacting pregnant women and their unborn babies? Dr. Reese, I don't know if you want to take that one.
Sure. So the good news is that we do not think that pregnant women are developing more severe disease than the normal population, which is not true with flu. There have not been that many cases worldwide of pregnant women getting COVID-19 though, so this is subject to change. But right now we think that pregnancy is not a risk factor for more severe disease. We also have not seen any transmission from the pregnant mom to the baby, to the fetus. So that is also good news.
Definitely.
Heather, Linda wants to know, if I had a flu shot, should I get another one?
No, we know that the flu shot's not effective against COVID-19, but if you haven't had a flu shot yet this year, please get your flu shot now, because we know flu is still spreading in our communities across Northeast Tennessee and Southwest Virginia. So get the flu shot now, and then get your flu shot for the next flu season.
We've already covered this, but really quickly, Mike wants to know, is coronavirus airborne, contact disease? How do we get this? I think it's important to reiterate.
So it's primarily close contact and what we call droplets. So someone coughs or sneezes, then they touch you, or you shake hands with them, or they touch an object and then you touch it and then eat or touch your face without washing your hands. So that's primarily at close contact within about 3 to 6 feet. So airborne, not so much, except potentially in healthcare situations where someone's having a special procedure done.
Sure.
Jessica, we don't want to leave you out there.
No, you're fine. So when you're thinking about the difference between droplet and airborne,
She's our expert.
think of like rain falling from the sky would be more droplet, 3 to 6 feet when a patient coughs or sneezes, versus airborne, which would be like a misty cloud. So that's a good visual to think about.
Oh, I like that.
Yeah.
That means we're all too close. But anyway, after the break, we're joined by representatives for Johnson City Schools and East Tennessee State University.
Monitoring the coronavirus, asking the experts continues after the break.
Thank you all.
Thank you.
Yes.
Welcome back. We are monitoring the coronavirus, and we have with us some educational leaders. Joining us now, East Tennessee State University President Dr. Brian Nolan and Christina Cottrell from Johnson City Schools. Dr. Nolan, just in from the university, you're making some schedule changes, right?
Yes, and thank you for the attention that you're bringing to this matter for folks throughout the entire viewing area. Here at East Tennessee State University, we announced within the hour that when our students go for spring break tomorrow, they'll be out for the break, and then the week after, and for the next 3 weeks through April 9th, we will teach the semester through an online format. The university remains open, courses remain in progress. We are pushing forward to the completion of the semester at commencement. There are a number of activities at the institution, however, that have been brought to a close. All major university events between now and April 9th have been canceled. Certain university facilities will remain open, our library, the Culp Center, etc. Others will close, such as the CPA. But our goal as a university is to ensure that our students have the ability to complete the semester, that we continue to engage in research, service, and all the things that define who we are as an institution. These are unique times. We've spent the bulk of 2.5 weeks preparing for what we announced today, and then we will spend the weeks adjusting to circumstances as they present themselves.
Wow, major news.
Major news. Okay, well, that answers our first question. So, Christina, let's go to you. Johnson City Schools are starting their spring break
On Monday.
on Monday
Yes.
as well. So, are there any steps being taken right now to prepare students, to prepare faculty in case something like this is needed at Johnson City Schools?
Absolutely. And for high-risk students, that can take place on a case-by-case basis also. We do have measures in progress right now, if and when that happens. So yes, we are getting prepared. And we're also in collaboration every day with state and local health officials, you know. So it's kind of a team effort in those determinations.
Dr. Nolan, the other major news of the day involving your university, the news from the NCAA that the March Madness tournament is canceled. That has just been a kick in the gut for Bucks fans who, like you, were there and were so excited. What do you want Bucks fans to know tonight in the midst of this disturbing news?
Well, I first want to say to our players how proud we are of them. To all of the seniors who've poured their heart and soul into this season, record-breaking year, 30 wins. To Coach Forbes and his entire team, thank you. Thank you for inspiring us. Thank you for making our dreams come true. Thank you for uniting this region around the university. It's heartbreaking that we'll not have the opportunity to watch the Bucks go to the Sweet 16 because we had the talent to be there. But the NCAA is making the same decision that we are. The health and safety of our students, faculty, and staff comes first. This is a rapidly unfolding situation. The numbers 2 days from now are going to look very different than the numbers today. And I support the NCAA's recommendation. But I sure wish we had the chance to be in Greensboro next week as we were taking on whoever we're going to take on. It's heartbreaking, and it's not the close we wanted to the year, but I'm still proud of the team.
We are wrapping up this half hour. Dr. Brian Nolan, thank you so much for being here. Christina Cottrell from Johnson City Schools, thank you so much for being here as well.
We hope to stay in touch with both of you in the coming days as we work to keep everybody informed, and stay with us. We'll take a break for the news at 6 next.